programs, as well as the continuing medical education programs, allow for continuing requirements that respiratory therapists, they attend 30 hours of CME lectures each year. They have professional certificates in pulmonary function, in rehab, and other areas attest to their continuing medical education ability. Respiratory therapists manage a whole pile of different ventilators. There are 20 to 30 different ventilators that respiratory therapists are responsible to manage and use with ease and facility. Along with the ventilators, they use devices such as oximeters, which measure oxygen saturation. They use capnography devices, which measure carbon dioxide and other gases, nitric oxide. So respiratory therapists are trained to administer all gases, nitric oxide, oxygen, and air, and helium-oxygen mixtures. In the performance of arterial blood gases, respiratory therapists obtain arterial blood gas samples anaerobically. They place these samples in blood gas analyzers and make determinations of the pH, the PCO2, the PO2, the bicarbonate, the base excess, and the oxygen saturation. And in interpreting arterial blood gases and manage patients according to their blood gases, as well as recommending the myriad forms of therapy that are required to adjust blood gases and return them to normal state. In the area of lung function and spirometry, respiratory therapists conduct and operate laboratories for lung diagnosis. The spirometry, the standard spirometry, measures lung volumes. Here a patient is breathing on a spirometer, and they are taking breaths, normal resting breaths, in and out. And this is called the tidal volume. At their end resting position, they take a deep breath in, and then they exhale it maximally. And this is called the vital capacity. The amount that is blown out, expired in 1 second, is called the FEV1. That's the forced expiratory volume in 1 second. The total volume that's exhaled is called the vital capacity. In this case, because it was forcefully exhaled, it is called the forced vital capacity. We can replot this on a volume time curve. The patient takes in a deep breath and blows out all the way. So this total volume expired is the vital capacity, equivalent to this volume here, forced vital capacity, the FVC. After 1 second, this volume that's expired is the FEV1, the forced expired volume in 1 second. And then the extrapolation of flow. Flow is volume per unit time. Dividing the vital capacity into 4 quarters. The first quarter is called the FEF25 point. The second portion is called the FEF75% point. So the average flow from 25 to 75% is derived, and this then becomes the FEF2575. And this all evolved into what is known as the ECG of the lung. And this is the flow volume curve. The flow volume curve has flow on the ordinate and volume on the abscissa. And that previous curve is replotted, flow versus volume. And from this we can see the peak flow, the FEF50, the FEF75, and the inspiratory peak flow. And that tells us a whole lot about obstructive lung disease. It determines whether or not the patient can respond to a bronchodilator, in which case, if they do, that presents us as having asthma. So all of the obstructive and restrictive lung diseases can be identified as an initial test with the flow volume curve. In cardiopulmonary exercise testing, respiratory therapy tests the ability of the patient to sustain aerobic metabolism. They measure the oxygen consumption and the CO2 produced, the carbon dioxide production. And this is then plotted on a graph. And limits of exercisability are explored, and cardiac and pulmonary function are determined in terms of normalcy or abnormalcy. We talked about sleep studies. The respiratory therapy organizes the electrodes, attaches electrodes to patients undergoing sleep studies with potential obstructive sleep apnea, and the patient is monitored overnight while they're sleeping, and diagnosis as to apnea are made, and then they institute therapy. Clinical research, many respiratory therapists are involved in evaluating bronchodilator drugs. And in monitoring and training patients with obstructive lung diseases in the home for early signs of chronic obstructive pulmonary disease. And patients requiring long-term oxygen therapy, respiratory therapists provide and train oxygen therapy. And in disaster relief, respiratory therapists use ventilators, portable ventilators, which are battery controlled to ventilate patients who are in respiratory failure. And respiratory therapists also qualify in disaster recovery in terms of the disaster recovery and nurse anesthetists. So you'll find RTs diagnosing lung and breathing disorders, interviewing patients to do chest physical therapy, analyzing breath tissue and blood specimens, managing ventilators and artificial airway devices, and consulting with physicians. In hospitals and intensive care units, in emergency rooms, in newborn and pediatric units, in operating rooms and sleep laboratories and skilled nursing facilities, in asthma education programs and smoking cessation programs. And they respond to the code blues in the hospital. They educate patients and families. They're in doctors' offices. They're in air transport and ambulance programs, and in case management programs. I hope by now you've learned about respiratory therapy and how they cooperate with nursing. Thank you.